I'm here, Dr. Michelle Juneau with Dr. Micaela Moen. She is with Atlanta Breast Care, a premier breast institute in Atlanta. She's a breast surgeon specializing in breast cancer. October is Breast Cancer Awareness Month, and we just kind of want to discuss prevention and also, what does skin have anything to do with breast and breast cancer? Because we see a lot of the same patients. We share a lot of patients that are at increased risk of breast cancer or have had breast cancer, as well as different types of skin cancers.
Yeah, so I think I would start with just saying the same basic lifestyle modifications that can help prevent or lower your risk of breast cancer is probably the same for skin cancer. So maintaining a healthy diet that helps promote your immune system, regular exercise, limiting alcohol intake, not smoking, all those things are probably the same things that help decrease your risk of skin and breast cancer. And then there are genetic components and familial components to both of these cancers. So if you have a family history of breast cancer or skin cancer, you might be at increased risk of getting that cancer yourself. And so there's increased screening and things that should go along with that. And the first step is really meeting with your physician and getting in touch with either a breast specialist or someone to talk about those risk factors and what we need to do to increase your screening.
Absolutely, and there's also some genetic testing sometimes that's appropriate.
Absolutely, so there's some key genetic mutations such as the BRCA1 or 2 gene mutation, also the CDKN2A, I think it is put you at increased risk of both breast and skin cancer. So when I see patients that have a family history of both or something, then my red flags go up and I want you to go see a genetic counselor to consider genetic testing, because that could mean we want to start you on mammograms, breast exams earlier than the normal age, which would be 40.
Right, and we, even starting at 18, we start screening people for melanoma that are at increased risk. And I often ask about, other cancers, of course, in their families, such as breast, pancreas, prostate cancer that can go along with that. So, as far as prevention, we've talked about, prophylactic things, healthy lifestyle. I would also, for skin cancer, we talk a lot about sunscreen and sun protection. And then, so typically, mammograms at 40, but if you are at increased risk, do you have increased frequency of mammography or breast MRI?
Yeah, so first I would say, starting in your 20s, 30s, being self-breast aware. Anybody can get breast cancer, and unfortunately we do see patients in their 20s, usually that's with a gene mutation, but I'm seeing a lot of younger women in their 30s that have no family history of breast cancer that are having a breast cancer. And so they're typically finding these on their own because they're not meeting those criteria for screening yet. And so being self-breast aware, doing your self-breast exams early on, getting to know what does normal breast tissue feel like for you, so that if there was a change, then you come and seek guidance from a physician and have us take a look. We can talk a little bit about the breast exam really quickly, but it starts with looking in the mirror and looking and comparing both breasts, making sure that they're symmetric, that there's no skin changes, texture changes, contour changes, and then lifting your arm up, making sure that there's no pulling in of tissue in different areas in your breast or at the nipple, and then inspecting closely the skin, making sure there's no dryness, scaling, nipple discharge, things like that. Then we say start feeling. You can start circular motions, really feeling for any differences in the tissue, comparing side to side. Is this side different than this side in this area? Is there any more firmer tissue? It's not necessarily going to be a little pebble or a lump that you feel. It's going to be a change, something that's different. And it's hard, but I want you to be aware so that if there is a change or you find something, that you can come and have us take a look at it. 40 is the regular screening start, but like I said, it's starting to see earlier and earlier, and I think eventually that age might get lowered. But certainly if you have a family history, we recommend starting 10 years prior to the youngest family member's diagnosis. So if they were diagnosed at 45, you're going to start screening at 35. Mammogram is the standard, but then there's ultrasound and MRI or additional imaging modalities that we can use. And if you're at high risk, you might need a mammogram every year and an MRI every year. And we typically recommend doing that at 6-month intervals from each other. So you're getting something every 6 months. In addition, you should be seeing us or your OBGYN or primary care to get a clinical breast exam, also 6 months apart. So twice a year, so we're doing frequent checks.
Yeah, I think that's great. I think the bottom line is early detection is the key. Patients that are detected early do far better than more advanced cases.
Absolutely. So we've come a really long way and far way in treatment, and people are doing really well, but the earlier the better. Also, then you might not need as much extensive treatment, less side effects as well. And so absolutely, the earlier we catch it, the more treatable, more curable, less extensive treatment that you might need.
And interestingly enough, we do see breast cancer manifest primarily on the skin, and patients come in with concern of rashes and things on the breast. Sort of my rule of thumb, and tell me if you agree, is if it's unilateral, I'm more concerned. If it's bilateral, I'm far less concerned.
Absolutely, and I think we both can do a quick, easy little procedure in the office to
Yes.
get to the diagnosis really quickly,
Absolutely.
and it can mean the difference between a benign skin condition or maybe a breast cancer.
Correct.
And we can, like I said, do it really easy in the office, and if you come in early and don't wait, it's
Yes.
better.
So, once, unfortunately, some people do have to have more extensive treatment, and we see them oftentimes, hair loss during chemotherapy, or even hair loss after the trauma of a major surgery and hospitalization. But also after radiation, they're also at increased risk in those particular areas for having skin cancers. And just having breast cancer alone is an independent risk factor for having non-melanoma skin cancers. So, we, in addition to the regular screening for breast, you should also, if you've had breast cancer at all, really be screened for that. And a lot of treatments we can do for hair loss, radiation irritation, some of the rashes that come along with chemotherapy. So we do all work together, kind of
Absolutely.
to treat the whole patient. So I think that that's important. And do you have any words for empowering patients? It's a difficult journey to go through any type of cancer diagnosis. There's so much hope now for all of these patients, and technology and advances in science have really given these patients so much hope and power. So do you have anything that you kind of say to your patients to keep their spirits high? Because I do think that, that hope and attitude really helps the patient.
Yeah, I mean, and unfortunately, there's such a historical stigma with breast cancer and a fear that goes along with it with women, but we really truly have come so far. You have to go through the treatment, and it's a tough, anywhere from 6 months to a year of treatment, but then you can put it behind you and move on and know that you have a really good chance of survival and a really low risk of recurrence. And then your team is going to help watch that for you. I don't want my patients to worry about it. I tell them, I'm stuck with you. We're stuck to each other
Yes.
for the rest of your life, and we're going to help monitor. So I don't want you to worry about it. Let me worry about it. And that's probably the biggest thing.
That's great. Thank you all for joining. Please come see Dr. Moen for any of your breast concerns or screenings and needs. And we're here at Dermatology Consultants always to take care of your skin.